Good evening, doctors. Welcome again. This is a quick revision of Neet PG, high yield, important one liner. So please go through this before your exam. Hope you will receive some related questions from this, but not same, but related. You can. Okay. Most common HIV infection in India is HIV-C. Severe metabolic alkalosis are seen in all except severe metabolic alkalosis seen in hypoxia, hypocalcemia, tetany, but it is not seen in pulmonary edema. Why this is not seen in pulmonary edema? Because I will show you one mechanism here. If there is dehydration, renal perfusion decrease, renin-angiotensin increase, aldosterone increase. So aldosterone responsible for retention of sodium and loss of potassium and H plus ion in urine. So it causes alkalosis in case of dehydration. So this is not a cause. I hope it's very much clear for you till here. Now, anti-epileptic of choice in post-diabetic peripheral neuropathy, it's pregabalin. Pregabalin. Now, hemolytic anemia due to intrinsic cell defect seen in all except it is seen in G6PD pyruvate kinase deficiency, hereditary spherocytosis, but not seen in autoimmune hemolytic anemia. Hope it's clear for you. Now, most common cause of pulmonary abscess in cystic fibrosis is Pseudomonas aeruginosa. ST segment elevation in ECG is not seen in. It's seen in ST segment elevation pericarditis, hyperkalemia, hypothermia, Osborne waves, not seen in hypocalcemia. So hope it's clear for you now. Sorry. Diagnosis criteria for infective endocarditis are all except positive ECG is not criteria, but fever more than 38 degree, 2D echo positive, blood culture positive for endocarditis criteria include except is positive ECG. EEG in petit mal epilepsy shows 3 to 4 hertz spike and wave activity. Okay, let's move further. Parkinsonism associated with which metal? It is mainly associated with manganese. And how to remember the Parkinsonism smart? As for Tuffingate, mask life faces, echinacea, bradycarnesia, R for rigidity, T for tremor. Okay. Now about Kawasaki disease, all are true except mucocutaneous lesion. Yes. CAD coronary artery disease involvement seen in child, but no suppurative lymphadenopathy. Except they are asking, so no suppurative lymphadenopathy. Okay. Now lateral medullary syndrome of or Wallenberg involves all except it involves cranial nerve 5, 9, 10, but not involve 12th cranial nerve. Okay. All are true regarding treatment of Guillain-Barré syndrome except corticosteroid we are not going to use, but we can use high dose of immunoglobulin. We can do plasmapheresis. High dose of immunoglobulin and plasmapheresis equally effective. Now, all rods seen most abundantly in subtype of AML, that is M3. The treatment here is all trans retinoic acid. Okay. Gasbox syndrome consists of spurious polycythemia. Okay. Pulsus bigimini is seen in. It is mainly seen in digitalis. Significant weight loss is determined as in tuberculosis. It's or determined as 5% in 1 or 2 months. Weight loss. Now, person having hepatitis E antigen negative, S antigen negative, surface antigen negative, anti-HBs positive, HBe positive, anti-HBc positive. Most correctly diagnosis is immunity due to infection of hepatitis B. Wernicke's area lesion causes fluency and meaningless speech. Early loss of bladder control is due to conus medullaris. Methemoglobinemia may result from exposure to dapsone, aniline, and sulfonamide. Pseudopolyps are seen in ulcerative colitis. Neuromuscular disorder is related to which type of lung cancer? Small cell lung cancer. Okay. All are seen in man 2B except in man 2B we see neuromas, medullary carcinoma, pheochromocytoma, but we never see hyperparathyroid. It is seen in man 2A. In man 1 we see pituitary involvement, parathyroid involvement, and pancreas involvement. So please revise this symptoms. Now, which mimics space occupying lesion in brain, that is cerebral abscess? Creatinine phosphokinase increased in alcoholic myopathy. Okay. And colofibrative therapy and after electrocardioversion also creatine phosphokinase increased in our body. All are seen in pheochromocytoma except hypocalcemia. We are not going to see in pheochromocytoma. We see headache, weight loss, and sweat attacks. All are true about pneumoconiosis. Asbestosis and smoking are synergetically to cause lung cancer. Central pontine myelinolysis seen with rapid correction of hyponatremia. Okay. Low specific gravity of urine seen in all except. This is not seen in diabetes mellitus, but low urine specific gravity seen in diabetes insipidus, polyuric phase of CRF, psychogenic polydipsia. Secondary deposit from carcinoma breast are commonest in bone. True regarding malignant parotid gland tumor, except facial should always sacrifice during surgery. Scarified during surgery. This is not true, but it is painful. Cervical lymphadenopathy, enucleation, tumor mass, not recommended. Okay. Cause of chromosome tropical pancreatitis is cassava ingestion. Chronic, not chromosome. Cause of chronic tropical pancreatitis is cassava ingestion. But in case of not tropical, simple chronic, then we can go for alcohol. If it is acute, then go for gallstone. 70-year male, chest pain, diagnosed CAD, USG gallstone management is wait and watch. Thyroid cancer developing after long standing goiter, that is follicular carcinoma. If it is by radiation exposure, then it is papillary carcinoma of thyroid. Most common used fluid for burn patient is crystalloid, or we can say RL, ringer lactate. What is the best way to control external hemorrhage? Give the direct pressure. Bentrell's score is used for acute appendicitis, or Alvarado score, you remember. In Nihas classification, type 3A is direct inguinal hernia. Most common infection in post-splenectomy period is pneumococcal infection. That's why 2 weeks before splenectomy we need to go for pneumococcal vaccination, and every 5-6 years after splenectomy need to go for pneumococcal vaccination. Treatment of choice for patient presenting with venous ulcer and incomplete perforator is subfacial ligation of perforators. Okay. Now, all are true about gastric carcinoma, all except most common in fundus. It is not most common. It is found in low socioeconomic status. H. pylori increased risk. Vitamin C protects, and distal stomach is the most common site for cancer. Staghorn calculi as a protease infection is triple phosphate. Most common retroperitoneal sarcoma is leiomyosarcoma. All are true about renal transplant except right kidney is preferred. No, left kidney is preferred for renal transplant. Heterotrophic donor has good prognosis. Boundaries of gastrinoma include cystic and bile duct, second and third part of duodenum, and junctional head of neck of pancreas. Okay, corkscrew esophagus seen in diffuse esophageal spasm. What is the treatment for blunt trauma of kidney? That is, go for conservative treatment. Most common site of esophageal perforation is cervical region. Okay. Reconstruction of a tip of a nose after an excision of a basal cell cancer is done by bilobed flap. Nerve injury, radical neck dissection leads to loss of sensation medial side of the arm. Nerve injured most commonly is medial cutaneous nerve of arm. Denver shunt used for ascites. All seen in von Hippel-Lindau syndrome except gastric carcinoma we are not going to see. Renal cyst we see, hemangioblastoma and renal clear cell carcinoma we see. Abdominal aortic aneurysm, indication of operation when size of aneurysm is more than 5.5 centimeters. Now, organism causing carcinoma of cervix, that is HPV, human papilloma virus, or it is associated with 16 and 18. Mirena releases 20 microgram levonorgestrel per day. Which type of trophoblastic disease has worst prognosis? That is postpartum. Lower one-fifth of vagina formed by urogenital sinus and Mullerian by upper was part of vagina. Inhibin level test of ovarian reserve is based measured by third day of menstruation, even LHFSH also third day of menstruation. Fetus most radiosensitive is 8 to 15 weeks. Treatment of neonate with vaginal bleeding, go for wait and watch. Drug of choice in malaria in pregnancy, that is chloroquine. It is safe in any trimester. Most common ovarian tumor is serous cystoadenoma. Serous cystoadenoma is the most common ovarian tumor. Investigation of choice for postdatism, go for USG. Most common site of fertilization is ampulla. Indication of ampulla is also most common site of tuberculosis of genital TB. Indication of cesarean section after previous cesarean section is CPD, contracted pelvis. Specific treatment for severe preeclampsia, go for termination of pregnancy, or severe eclampsia is also, so specific treatment is termination of pregnancy. Or drug of choice in eclampsia is magnesium sulfate. True about circumvallate placenta is fetal plate is smaller than basal plate. Investigation of choice in postmenopausal bleeding is fractional curettage. Amount of fluid at 12 weeks of pregnancy, that is 50 ml, 20 weeks is 400 ml, 36 to 38 weeks is 1 liter or 1000 ml, term is 600 to 800, 43 week is 200 ml. During hysterectomy, ureter is liable to injury at where it crosses the uterine artery. True about menopause. Menopause we see increase FSH. Best parameter estimate the age of first trimester is crown rump length. In second trimester go for BPD, and third trimester BPD plus head circumference. Okay. Now all are true about genital infection, that is clue cells are associated with Gardnerella, and treatment here is by metronidazole. So guys, have a good day, goodbye, that's all for today. Please don't forget to revise this important one liner because before your exam, so please go through it. Thank you, good day, goodbye. And if you still not subscribe my channel, please subscribe it. And if you like this video, put like on it. Thank you, good day and goodbye. And please don't forget to watch this video before your exam. Watch it.